Hello, my name is Sierra Call. This video is going to consist of information about my agency slash organization that I am completing my internship at. The agency slash organization that I am completing my internship at is called Avalon Hospice. Avalon Hospice is a for-profit agency. However, they do take multiple insurance. They also have some programs that people do donate money to that actually help pay for other people's services that people that are not able to pay for the services that we provide. They're able to use that money to pay for the services if they qualify for that program. The mission of the agency slash organization is to provide passionate care and extraordinary services to the patients' families that they serve. The organization has several values and goals as well. Their main goal is to try to be authentic, show compassion, express accountability, and to consider the future and how they can improve their future services and what they can do for the future for the patient's families and for the patient. Another goal that the organization has is to deliver expectational patient care and outcomes through likely skilled professionals and have compassionate clinicians and other professionals working for them. Another goal that they have is to achieve consistency, education, and to provide a highest level of field support through the best practice processes, training, and information sharing. They want to be able to communicate with the community and have many resources and in collaboration with other professionals to be able to provide the best quality care for their patients and families that they serve. They also have a goal to serve more patients and to touch more lives by bringing hope and comfort and recovery to the patients and the patient's family. So first, I just want to give a little introduction about what hospice is. Hospice affirms the concept of palliative care as an intensive program and that enhances comfort and promotes the quality of life for individuals and their families. When cure is no longer possible, hospice recognizes that a peaceful and comfortable death is an essential goal of healthcare. Hospice believes that death is an internal part of life cycle, and that intensive palliative care focuses on pain, relief, comfort, and enhanced quality of life as appropriate goals for terminally ill. Hospice also recognizes the potential for growth that often exists within dying experiences for the individual and their family, and seeks to protect and nurture this potential. Now to discuss who's available for these services. So hospice services are appropriate if the patient's physician and the hospice medical director has clarified that the patient has a terminal illness, that if its disease runs its normal course, death may be expected in 6 months or less. However, at times, hospice patients may be on hospice longer than 6 months because we never know when death is going to actually happen. Hospice does provide care for patients with all kinds of illnesses. They just have to be terminal illnesses to qualify for our services. And hospice services at our agency is available for all patients. It doesn't matter their race, their religion, their gender, or age. It doesn't matter how old someone is. You can be on hospice if you qualify with the terminal illness. Hospice addresses needs and the appropriateness during the last phase of life by including individual and their family, trained volunteers, caregivers, and clinically professionals in the caregiving team. The interdisciplinary approach to care services of the individual's physical symptoms and the emotion and spiritual concerns of the patient and family. The team works together to develop a plan of care and to provide services that will enhance the quality of life and provide support for the individual and family while respecting their wishes during the terminal phases of illness and the bereavement period. As I said previously, hospice, they like to work as a team and to collaborate with all the professionals that need to help the patient and the family. The hospice team develops a care plan that meets each patient's individual's needs for pain management and symptom control. Support for the family caregivers is also accessed throughout the care period. While the range of services provided will vary depending on each person's individual situation and specific needs, hospice staff are available 24 hours a day, 7 days a week. The Avalon Agency has on-call staff services or on-call services, which include administrative call by a senior management member, clinical call by a registered nurse, or other members of the team, such as a social worker, the chaplain, or spiritual care coordinator. This on-call service is 7 days a week, 24 hours a day. However, usually use on-call services after business hours or after the office closes. Now discuss the different services that Avalon Hospice provides. Hospice provides physician services for the medical direction for patients' care provided by either the personal physician or a physician that is with Avalon Hospice Agency. Regular visits by nurses is a service that is provided to monitor the patient's condition and provide care and maintain patient comfort. Another service that's provided is hospice aid visits to assist with bathing, dressing, and toileting, and etc. There's also spiritual care services for both the patient and the family. There's also a chaplain if the family or patient wishes to have one. There's also a social worker, which the social worker assists with resources and problem solving in addition to emotional support. They provide assessments. Such as psychological, emotional assessments of the needs of the family and the patient. The social worker also advocates for the patient and family. The social worker also assists with team with psychosocial aspects of care to ensure continue on care interaction. In addition, the social worker provides in-service training for facilities and hospice volunteers on related social issues. The social worker has a complex job, and it's very important for the family, if they wish to have a social worker, for us to be there and support their family in whatever that they need. The agency also provides a service of bereavement counseling, in which bereavement counseling lasts up to a year after a loved one has passed away. They also have family training, coaching on how to care for the patient. They have short-term inpatient care when patient or symptoms become too difficult to manage, or when a caregiver needs respite hours. They provide volunteer support. They have physical, speech, and occupational therapy. They have dietary counseling. The agency always has meetings every week to discuss what's going on with different patients and how they can collab, and that way everybody's on the same page. Even though there's documentation, it's always good to have that verbal communication. That way, everybody knows what's going on with the patients they are taking care of. As a student with this organization, I have been able to learn how to navigate planning for end-of-life care, understanding the treatment plans, and learning different kind of interventions and different kind of note-taking that the social worker does do. I also have been able to learn about bereavement counseling as well, because in my SW that I'm with currently, they do bereavement counseling, and that's a different spectrum of what a social worker usually does when they just have one caseload. It's a great place to learn a lot of medical terms and how that can affect a family, and how end of life does affect the family and the patient. And you learn how to collaborate with the community and to work as not just a clinical social worker, but at a macro as social worker as well. So you're working in the community, and then you're working with different professionals and non-professionals to help make the best services for your client and help them have the best quality of life. I think a lot of challenges many social workers can have working in hospice is there's a lot of gray areas. I think working in this particular situation, a social worker needs to be able to manage their stress and be able to separate their personal feelings and professional feelings. And there's also a lack of resources and community things for people to do, and we have to navigate that and just to do a lot of research. And that can be a challenge, especially in the East Tennessee region when there's not a lot of services that are provided for certain populations of people.